Hello to everybody in Bari. I was invited to give a talk on cannabis and cancer. My name is Franjo. I'm working in a medical practice. I'm the executive director of the International Association for Cannabis and principal of the Neuro Institute in Germany. Switch to the next slide, please. Well, I'm chronically ill, and so I cannot travel to you, to Italy, to Bari, and many greetings from Germany to Italy. Next slide, please. Well, first I want to talk something about cancer in general. About 500,000 people in Germany get cancer every year. It's a population of 80 million, so in Italy 60 million, so maybe about 400,000 people with cancer. And in Germany, 220,000 die every year from cancer. So in Italy, maybe 180,000 or something. Every second citizen is getting cancer during his or her life. But those who do not get cancer do not die from it. So the most important thing is not to get cancer. And the main causes for cancer are genetic defects caused by environmental factors, for example, smoking or overweight or something like that, hereditary transmission, and mistakes during cell division. And it's possible to reduce half of the cancers by reducing environmental factors, for example, smoking and alcohol and so on. There are about 200 different genetic defects that may be involved in cancer developments. We call them oncogenes, which promote cancer, and tumor suppressor genes, which suppress the production of cancer. If there are deficits, then cancer may be caused. Next one, please. So what is about cancer treatments? What do we have today? Of course, we have surgery, which started about 120 years ago with the first breast cancer operations, surgery. Then we have radiation therapy, which started at a similar time in the end of the 19th century. Then we have chemotherapy since 1947. The first child was cured by chemotherapy was in 1962. So it's not so long ago. It's nearly about 50 years that first patients could be treated successfully with chemotherapy. Then we have some other therapies, for example, anti-oncogenic therapy, therapies with monoclonal antibodies, and so on, immunotherapies, and so on. But the mains are surgery and chemotherapy today. But immunotherapies are coming very quick now today. Next one. So, when did the story with cannabis and cancer start? It was in 1975. This was a group which researched the effects of some cannabinoids on a certain kind of lung cancer, so-called adenocarcinoma of the lungs. And they tested delta-9 THC, which is the main compound in cannabis marijuana, and delta-8 THC, and cannabinol, and cannabidiol. Today, when we speak about cannabis and cancer, we usually speak about THC, which is delta-9 THC, and CBD, which is cannabidiol. So what was the result? The result was that mice with this lung cancer treated with THC and delta-8 THC and CBN, the scientists saw a decrease in size of the tumor. CBD was not effective in this study. And then for 20 years, nothing happened. This was the first study, but for 20 years, nothing happened again in this research area. So the next slide, please. And the next research was done with And the study was published in 1996. And this was not a study to look at THC is cancer, but it was a research group at the National Institute of Environmental Health was looking if THC may cause cancer. And they did it the following way. They made research in mice. And there were groups of 60 to 70 male and female rats and male and female mice. And the rats received 5 milligram THC per body weight, kilogram body weight, 50 milligrams per kilogram body weight, or 50 milligrams per THC body weight. And the mice received 125 to 500 milligram THC. And another group received nothing. And the animals were treated for 2 years. So for 5 days in the week, for 2 years, they received high doses of THC. And after 2 years, the scientists looked what happened to the rats. And they saw that rats who received nothing, after 2 years, 46% were still living. So a rat is usually living about 2 years and 2 years and a half, and then it's finished. But the rats who received 5 milligrams of THC per kilogram body weight, there were 74% of rats still living. And also in the other groups, 68% and 66% of rats were living. That means rats lived longer with high doses of THC, received every day or 5 days a week for 2 years. So this research boosted further research in other research groups. For example, the group by Professor Guzman in Madrid, or Professor Hinz in Rostock in Germany, and several scientists now worked on this issue. Can we reduce this finding? Are there other cannabinoids which are inhibiting cancer growth? So the next one. So when we speak about cannabis and cancer, we usually speak about palliative therapy. That means THC and cannabis is able to inhibit nausea and vomiting. It is able to increase appetite. It is able to reduce pain. And it may have potential undesired effects, for example, euphoria, sedation, so that people may sleep better. We have several studies on this issue. The first clinical study on nausea and vomiting was conducted in 1975. The first study on cancer patients and appetite was conducted in 1976. So we have several studies now which show that THC and sometimes also CBD may reduce symptoms of cancer, problems with cancer or with the treatment of cancer, for example, cancer therapy. So this is rather good established, but the treatment of cancer, direct effect of cancer on cancer is not so sure. We have mainly only animal studies. Next one, please. So the summary is the following. Cannabis and cannabis-based medicines may be used in cancer therapy for the treatment of symptoms of nausea and vomiting, reduced appetite, pain, depression, problems. So we have one therapy for several symptoms. So cannabis may be very helpful in cancer and in cancer treatment. So we have very limited data on the anti-cancer effects of THC, but we are now speaking what we know today. So next one. So this is one of my patients. He has basilioma, which is a skin cancer. And this is also the cancer which Rick Simpson treated on himself. with his oil. And my patient also treated his basilioma. You see it on the nose, on the surface of the nose, the right side, and he treated himself with also with the cannabis extract. And he put 4 times a day a cannabis extract on his nose. And it looked, after 1 week, the next slide, please. It looked like this. You see, 4 times daily, he put cannabis extract on his nose, and something is happening. Yeah. And he continued treatment, and after 2 weeks, please the next slide. So you see that the basilioma has disappeared. So the same effect which happened with Rick Simpson's, and several patients did it already. So cannabis is very good working externally to treat basilioma, but also some other skin cancers. Next one. So this is after 10 months. The basilioma this has gone away. So the next slide. We have a few case reports on cannabis in cancer. I want to tell you about a case report of acute lymphoblastic leukemia in a 15-year-old girl. Acute lymphoblastic leukemia, or ALL, is one of the most frequent cancer diseases in children, and it's treated usually very well. About 80–90% of children survive, but this girl had a severe mutation of the Philadelphia chromosome, and this is a very aggressive form of ALL. And it was treated for 34 months in hospital with aggressive chemotherapy, with bone marrow transplantation, with radiation. And after 34 months, the doctor said, okay, we can do nothing for you. And they sent the girl home. And the girl started a treatment with cannabis extracts. They started with hashish oil, and in the next slide, you see the number of lymphoblast cell counts in her blood. And you see that the number is increasing up to about the 30th day or 27th day. And then obviously the girl received enough THC CBD so that the number of cancer cells decreased rapidly. This is a very good case report because it is sure that the girl wasn't only treated with cannabis, and the cancer development could very well be followed in the blood. So after about 1 month, we saw in this girl, in effect, it died. She died after about 6 months, but this was mainly due to her severe illness, because she was treated for about 3 years with heavy treatments, with severe side effects. And maybe if she had started earlier with the cannabis treated together with chemotherapy, she could have been healed, but we don't know. Next one, please. So I want to present to you another animal study which was conducted at the Complutense University in Madrid, in Spain, in glioblastoma of rats. Glioblastoma is a very aggressive brain cancer. We have not very effective chemotherapeutic agent to treat glioblastoma. Usually they are, there's done surgery, the glioblastoma is removed, and when there is a relapse, when the glioblastoma comes back, we can do chemotherapy or radiotherapy, but this is not very effective. And in this study, there were 45 rats where the scientists induced glioblastoma. And then these 45 rats were put in 3 groups. 15 rats received nothing, only their normal diet. 15 rats received THC, and another 15 rats received a synthetic cannabinoid, which acts similarly as THC. So we have 3 groups. What happened with these rats? So at about 8 days, all the rats in the groups who had received nothing had died. So and one moment. No. After 18 days, they had died. Sorry, after 18 days, all the rats have died in the group who had received nothing. And in the other 2 groups, there was a similar result. And it was about 1/3 of them, they died within 18 days. So THC and the other cannabinoid was not effective. In another third of the group, the animals lived from 19 to 43 days. So their survival increased considerably. And in another third of the groups who were treated with cannabinoids, the glioblastoma disappeared. So treatment was very effective. So this is what we often see in animal research, that in some animals we see no effect of THC or other cannabinoids. In another part of the animals we see a little effect, and in other animals we see a good effect. So you do not know if the rat or the mouse will respond or not, and this may be similar in humans. We do not know because we have not many human studies. So we come to the next. So the mechanism of action. How does THC and also CBD act against cancer? We have mainly 4 mechanisms of actions. First, a direct effect on the tumor. THC and CBD can induce apoptosis. What is apoptosis? Apoptosis is programmed cell death. The cell is killing itself. So THC and CBD may induce self-killing of cancer cells. And in other cancer cells, it may inhibit proliferation. This means cell cycle and so on. It may inhibit the proliferation of and the growth of the tumor. So this is one mechanism of action: induction of apoptosis and induction of reduction of proliferation. Another mechanism of action is inhibition of production of new blood vessels. We call this neoangiogenesis. If cancer or if a tumor is larger than 1 or 2 millimeters, the tumor needs many new blood vessels to be able to grow very fast. And if you can reduce the production of blood vessels, then you can reduce the proliferation, the growth of the tumor. And the third mechanism is reduction of metastasis. What does the cancer cell be able to do to do metastasis, to produce metastasis? It must be able to migrate, and THC and CBD inhibit migration of the cancer cells. It must be able to bind to new tissue, which we call adhesion. And it must be able to invade into the new tissue, in the new organs. And all these 3 effects, migration, adhesion, invasion, is reduced by cannabinoids. And the 4th effect is that it may have an effect of the immune system, and it may change the immune system so that it might fight cancer better. So these are the main four aspects, main four mechanisms of actions. The next, please. So here is just a cell, how induction of apoptosis is happening, induction of programmed cell death. We see the cannabis receptor, and then there is something happening in the cell, and some chemical issues are happening, and at the end there is apoptosis and cancer cell death. It's not necessary to understand everything, but this is happening in the cancer cells, in different cancer cells, very similar. So this is a common effect in many cancer cells. So next one. So both THC and CBD have anti-cancer effects. What do we know from THC? We usually know that it is pain reducing, appetite increasing, relaxing muscles, inhibition of nausea. That's what we know from THC very well. And CBD is another cannabinoid which is non-psychotropic, non-psychedelic, and it's often in the hemp plant, up to 4% in flowers of the fiber hemp. It has anti-inflammatory, anxiolytic, antipsychotic, anti-epileptic effect. So these are the main two cannabinoids which may also be used in cancer therapy, which have known other effects. Next one. So in this year, in February, we had a press release by GW Pharmaceuticals about the first controlled study in brain cancer, the first controlled study in cancer ever with cannabinoids. And the researchers had used Sativex, which is a cannabis extract with THC and CBD, and they treated 21 patients with glioblastoma. These patients had undergone surgery, but the glioblastoma had reoccurred, and then doctors wanted to make chemotherapy. And 12 patients of these 21 patients in the study, they received the chemotherapeutic agent temozolomide, which is usually the usual chemotherapeutic agent in glioblastoma. 12 patients received temozolomide and the cannabis extracts, and another 9 patients received temozolomide and a placebo. And after 1 year, 53% of the patients who received only the chemotherapeutic agents, the temozolomide and placebo, were still alive, while the 1 year survival in the Sativex group, those patients who received the cannabis extract with THC and CBD, there was a survival of 83%. So there was a larger proportion of patients who survived 1 year after treatment had started. So this is the first controlled study in cancer with cannabis. Next one. We have some hints from epidemiological research that cannabis may be helpful in cancer. This study, which I'm presenting here, was conducted by the group by Professor Donald Tashkin at the University of California in Los Angeles. He is researching effects of cannabis smoking on the respiratory tracts, on the lungs, on the mouth, for more than 40 years, since the 1970s. And he also wanted to know what is it doing on cancer development. And in the year 2006, he published the largest epidemiological study on cannabis smoking and cancer of the respiratory system, mainly lung cancer. There were about 1,200 cancer patients with different forms of cancer, mainly lung cancer, 611 with lung cancer, 403 with mouth and throat cancer, 90 lungs, and 180 esophagus cancer, and they compared it with 1,040 healthy people, and they looked at the differences. The healthy people were with similar ages, similar sex, similar socioeconomic status. And what they saw is that even strong and long-term cannabis uses was not associated with lung cancer. And in fact, it was so that there was a small decrease of the risk of lung cancer. For example, the lung cancer risk decreased about 40% in the cannabis using population. Lung cancer was not more often, not more common. What was rare, more rare. And also the other cancer forms, as you see here, were decreased. So cannabis smoking does not cause cancer of the lung or the throat or the mouth in this study, in the largest epidemiological study ever. We don't know what would have happened if they would have not smoked cannabis, but eaten. It may have even be better. Next one, please. So we have very few clinical data on cannabis cancer, which I told you before. We have some animal experiments. For example, in these cancers which are listed here, in brain cancer, colon cancer, liver cancer, cancer of the pancreas, breast cancer, prostate cancer, lung cancer, thyroid cancer, melanoma, which is black skin cancer, non-melanoma skin cancer, for example, basidoma, leukemia, oral cancer, neuroblastoma, which is a cancer of children, and plasmodium. But we have many, many more cancers, and we have even no animal data on it. So the next one. What we see in several cancers is that cannabinoids and certain standard treatments may act synergistically. They may increase their effects. For example, here's an example. CBD increases the effect of doxorubicin in breast cancer. CBD inhibits cancer by activation of the vanillin receptor 2, and it was effective in 2 mouse models of triple-negative breast cancer, which is a very aggressive breast cancer. And what we see is that CBD increased the uptake of doxorubicin into the cells. So doxorubicin acted more effective. So if CBD and doxorubicin were taken together, the effect was higher than if we gave the mice CBD or doxorubicin alone. And that is what we see with several other chemotherapeutic agents. Next one. So here's a small list of what has been done so far. That melphalan, which is a chemotherapeutic agent, standard chemotherapeutic agent, and a synthetic cannabinoid, which is called WIN, may act synergistically in plasmacytoma. Telotolomid and CBD and THC may act synergistically in glioblastoma. That was the clinical study we had above, which was also seen in animals, of course. And we saw doxorubicin and CBD in glioblastoma and also breast cancer. Vinblastine and CBD or THC in leukemia. Radiation and CBD or THC in glioblastoma. Radiation plus this synthetic cannabinoid in breast cancer, while THC was reducing the effect. So it may not always be synergistic. It may also reduce sometimes the effect. And we see some other synergistic actions of CBD and standard treatments. So next one. So what are the major results of research? THC usually inhibits tumor progression but in some cases it promoted tumor progression. For example, in a breast cancer model with mice, this is the 4T1 mouse model. This is a special model because these breast cancer cells, they do not have cannabinoid receptors. So THC cannot act on the breast cancer because there are no receptors. So we see about 95%, we see that THC is tumor inhibiting, but in a very few animal studies, we saw a tumor promoting effect. So CBD is always inhibiting tumor growth. And what we also see is that THC and CBD were synergistic in some experiments. Usually only one cannabinoid was tested, but if two were tested together, there was usually a synergistic effect. So THC and CBD should be given together. So what we also see in some studies is that cannabinoids may inhibit chemoresistance. Chemoresistance is that after a while, a certain chemotherapeutic agent is no longer working. It works for 3, 4, 5 months, and then there is chemoresistance. That's what we also see with antibiotics. And cannabinoids may inhibit this development of chemotherapy resistance. And the fifth issue is that cannabinoids act synergistically with some other treatments, not with all, but with some. So, next one. So, what is the preliminary conclusion for therapy? The effects of THC and CBD are dose dependent. So, higher doses work better than lower doses. So, we should take as much THC and as much CBD we can take. Since CBD has no side effects, nearly no side effects, people should take high doses of CBD. And then they may add THC to increase the effect of CBD, because a combination of THC and CBD may be better than a treatment with one cannabinoid alone. This may not be always the case, but what we see currently is that it may be better than one cannabinoid alone. It is currently not known what is the best ratio of THC and CBD. We see much in the internet about certain ratios, 4:1 or something like that. We do not know it currently. And it can be assumed that this may be different for different cancers. For example, we see in certain forms of breast cancers in mice that CBD is more effective than THC. And in other cancers, THC may be more effective. We need much more research to be sure about the best ratio of THC. The fourth issue is, if THC is not well tolerated, high doses of CBD may be used. It is good to use high doses of THC, but often people do not tolerate it well. So there are many patients who do not tolerate more than 5 or 10 milligrams of THC, but they may tolerate 500 milligrams of CBD. So if THC is not well tolerated, you should give high doses of CBD and then add THC. The fifth issue is a treatment with THC and CBD is not an alternative to standard treatment, but may be used as an additive. It's not an alternative, because what we see in animal studies is that in many animals, CBD and THC does not work at all. In some animals, there may be a little effect or a moderate effect, and in some animals, it seems to work very good. And you do not know if it will work in you. So if you read in the internet that a cannabis extract is treating every tumor, this is nonsense. The treatment with THC and CBD is not an alternative, it is an additive. The sixth point is, it can be assumed that the efficacy of THC and CBD is very different in different people, as seen in animals. So you may try, but you do not know what will happen. Next slide, please. Many thanks.